The blood wouldn't stop. It sheeted across the operating table in waves, soaking through the surgical drapes, pooling on the floor beneath Dr. Victor Hale's shoes, while the heart monitor screamed a single, unbroken tone. The patient, a 43-year-old father of three who'd been hauled in from a highway wreck 40 minutes ago, had just flatlined. Hale stepped back, pulled off one glove, then the other. "Time of death," he said, not even looking up, 22:14. Nobody moved. Nobody except the scrub nurse in the corner. The quiet one. The one nobody ever bothered to learn the name of, who walked straight to the table, shoved Hale aside with both hands, plunged her bare fingers into the open chest cavity, and said in a voice so calm it didn't belong in that room, "No, he still has time. If you've made it this far, stay with me, because what happens next will change everything you think you know about the woman they called just a nurse." Subscribe so you don't miss a single part of this story. Hit like if it already has you holding your breath. And drop a comment telling me what city you're watching from. I want to see exactly how far this story travels. Her name was Emma Carter. She was 31 years old, 5'6", with short cropped dark hair that she kept tucked behind her ears during shifts and let fall loose during the 12-minute walk home through Ashford City's east side. She rented a studio apartment above a Vietnamese bakery on Caldwell Street, owned 2 pairs of scrubs, a duffel bag she kept packed at all times under her bed, and a prepaid cell phone she replaced every 4 months. She had worked at Riverside Memorial Hospital for 11 months. She filed paperwork quietly, handed instruments without being asked twice, stayed late when they needed her, and arrived early when they didn't. She never requested overtime pay, never complained about the weekend rotations, never pushed back when the charge nurse reassigned her patients without explanation. She blended in the way certain people learn to blend in, not by accident, not by shyness, but by design. Nobody at Riverside Memorial knew her real name. Nobody knew what she'd done before Ashford City, or why she'd come here, or why she kept that duffel bag packed like she expected to be gone before morning. What they knew was this: Emma Carter was a scrub nurse on the surgical floor, 3 years out of community college. Unremarkable references, no publications, no awards, no affiliations. She attended the holiday potluck once. She brought store-bought cookies. She didn't stay long. That was all anyone needed to know about her, as far as most of Riverside Memorial was concerned, especially Dr. Victor Hale. Hale had a reputation that preceded him into every room he entered, which he preferred. 52 years old, chief of cardiovascular surgery, the kind of man who kept framed magazine covers in his office and referenced them in conversation. He'd been featured in Ashford Medical Quarterly twice. He kept the issues stacked near the door where visitors couldn't miss them. He was technically brilliant. His outcomes were good, not great, not the best in the state, but good enough to protect his position, and he knew precisely how to protect his position. He spoke at conferences. He cultivated relationships with the board. He was charming at fundraisers and exacting in the OR, and the nurses who worked under him had learned very quickly that his exacting nature cut in every direction. He called Emma Carter when he acknowledged her at all. Sometimes he called her that one. Once, in front of 3 other staff members, he'd asked her to pass him a clamp, and then, when she handed it over, said, "Did you even go to school for this?" Without looking at her. She hadn't answered. She'd handed him the next instrument before he asked for it, and he'd taken it without comment, and that was that. She didn't take it personally. That would have required caring what he thought of her. The night Marcus Webb came through the trauma bay doors, Riverside Memorial was already stretched thin. It was a Thursday, not the worst night, not the best, and the ER had been running on reduced staff since 6 o'clock when 2 nurses called out sick within an hour of each other. Emma had picked up the overflow without being asked, moving between floors with the unhurried efficiency that made charge nurses love her and surgeons forget she existed. Webb arrived at 21:32 by ambulance, post-MVA, blunt thoracic trauma, blood pressure dropping. The paramedics were calm but moving fast, which meant it was bad. Emma was in the corridor when they rolled him past, and she fell in with them automatically, reading the vitals on the transport monitor before anyone said a word. 43 years old. Restrained driver, T-bone collision, passenger side impact, airbag deployed. Alert on scene, deteriorating in transit. BP 74/40 and sliding. She looked at his face as they moved. He was conscious, barely, eyes fixed on the ceiling tiles rolling past above him. He had a wedding ring on his left hand and a child's crayon drawing tucked in his jacket pocket. Visible at the collar, a folded piece of paper with yellow and blue marks, the kind a kid makes when they want to give you something to carry with you. She looked away. The trauma team converged. Dr. Hale materialized from somewhere down the hall, already gloved, moving with the particular authority of a man who considered his arrival the turning point of any situation. He took one look at the imaging, aortic dissection, catastrophic, requiring immediate surgical intervention, and declared them going to OR2 in a voice that meant he'd already decided this would be one of his good nights. Emma scrubbed in. The first 40 minutes were controlled chaos, which was the best version of chaos. Hale worked with precision, his team moving around him like a practiced mechanism, and Emma handed instruments and monitored and stayed where she was supposed to stay and said nothing she wasn't asked to say. Then the aorta gave way. It happened fast. A rupture at the proximal arch, catastrophic hemorrhage, the kind that fills an operating field in seconds. Hale's voice didn't crack, but it changed register, the way voices do when a surgeon's mind is recalculating and finding no good answers. He worked. His hands moved. The suction couldn't keep pace with the blood, and the monitor began screaming, and the anesthesiologist said, "We're losing him," in the flat clinical tone that means it's already happening. Hale kept working for another 3 minutes. Then he stopped. He stepped back from the table, and the room went very quiet, quieter than operating rooms have any right to be, and he stripped one glove and then the other and said, "Time of death, 22:14. And the sentence landed in the room like a stone in standing water. Nobody moved. Emma was already moving. She didn't announce herself. She didn't ask permission. She crossed to the table and put her hands on Marcus Webb's open chest with a directness that made 2 of the circulating nurses step backward, and she said, in a voice that had no apology in it anywhere, "No, he still has time. Carter." Hale's voice was low and precise, the way it got when he was about to be obeyed. "Step away from my patient." His aorta didn't fully transect. She wasn't looking at Hale. Her fingers were moving. The posterior wall is intact. There's still perfusion to the spinal arteries. He's been pulseless for 90 seconds, not 4 minutes. The monitor lag is from the sensor displacement when the rupture happened. Silence. "You can verify that," she said, "or you can let me work." She didn't wait for the answer. Her hands found the anatomy the way hands find things in the dark when they've found it before, many times, in conditions worse than this. She applied manual compression to the aortic arch with her left hand, and with her right she reached for the suction, cleared the field herself, and began. What she did next would be discussed in hushed voices around Riverside Memorial for weeks. It wasn't textbook. It didn't look like anything taught in standard surgical training. It was faster than it should have been possible to be, more assured than any nurse, than most surgeons, had any right to be, and the movements had a quality to them that the senior perfusionist, a 20-year veteran named Dale Ostrowski, would later describe as like watching someone who'd done it in the dark, for real, with people shooting at them. He meant it as an observation, not a metaphor. The bleeding slowed. The monitor remained flatlined. Emma didn't look at the monitor. She worked with the particular concentration of someone who has decided the environment around them is irrelevant. Hale stood at the edge of the room. He hadn't left. He should have left, but he hadn't. And Emma was aware of that the same way she was aware of everything in her peripheral vision. Cataloged, filed, not engaged with right now. 4 minutes and 17 seconds after she stepped to the table, Marcus Webb's heart resumed sinus rhythm. The monitor changed its tone. Nobody spoke. Emma completed the compression, checked her repair, stepped back and looked at Ostrowski. "Vasopressors," she said. "Start low, titrate up. He's going to drop again in the next 90 seconds while the pressure redistributes." He stared at her. "Please," she added, because she'd forgotten for a moment where she was. He moved. She was right about the pressure drop. She was right about the timing. Marcus Webb was transferred to the ICU at 23:08, alive, stable, with a cardiac repair that the cardiovascular fellow who reviewed the OR footage the next morning would describe privately to a colleague over coffee as technically unlike anything I've been trained to do or have seen done. The questions started before Emma made it out of the scrub room. She'd known they would. She'd moved too fast and too sure, and there were too many people in that operating room, and some of them were curious in ways that couldn't be managed with silence. She changed quickly, methodically, the habit of someone who has a practiced exit, and was reaching for her bag when Dr. Patricia Sung appeared in the doorway. Sung was the director of surgical services, 50-ish, with a particular economy of movement that comes from running a department for 17 years. She didn't have Hale's flair. She had something better. She noticed things. "Emma," she said. Not Carter. Emma. "Dr. Sung, I need a few minutes." "It's late." Emma kept her voice neutral. "I have another shift at 7. 5 minutes, Sung said. "My office." It wasn't a request framed as one, and Emma calculated the available options in the span of a breath and chose the one that produced the least scrutiny. She followed Sung down the corridor. The office was small and organized to within an inch of its life. Stacks of folders with the edges aligned, a whiteboard with a color-coded departmental schedule, a single photograph on the desk that Emma didn't look at. Sung closed the door. She didn't sit. "Where did you learn that repair technique?" she said. "Direct. No preamble." "I read a lot," Emma said. Sung looked at her for a long moment. "That's not a surgical textbook technique, Emma. That's not even a current technique. What you did tonight, the manual arch compression with simultaneous distal perfusion maintenance, I've seen that described in one context. One," she paused. "Field surgery, combat conditions. Mr. Webb is alive." "I know he is." Sung's voice didn't change. "I also know that what you did shouldn't be possible for someone with your listed credentials. And I know that Victor Hale is currently in his office, furious, and that furious men in positions of power tend to cause problems when they're embarrassed in front of their peers." Emma said nothing. "I'm not your enemy," Sung said quietly. "But I need to understand what happened in that OR tonight before someone else decides they need to understand it first." The fluorescent light above them hummed. Down the hall, a cart rattled past. Emma listened to it go. "He was dying," she said finally. "I could see he wasn't past the point of help. I did what needed to be done. With skills you shouldn't have. With skills that worked." Sung studied her. Whatever she was looking for, she didn't find it or found it and filed it differently than Emma expected, because she simply said, "Go home, Emma. We'll talk tomorrow." Emma nodded and left before Sung could change her mind. She didn't go home. She walked 6 blocks east on Meridian Avenue, stopped at a payphone she'd located in her first week in Ashford City, a habit, always knowing where the payphones were, and stood looking at the receiver for a full minute before she decided against making the call. It was fine. It would be fine. One procedure, one save. People would talk for a few days, and then something else would happen and the talking would shift. She'd done it before, demonstrated too much, attracted brief attention, let it pass. It always passed. She walked home. She didn't sleep. By the next morning, it hadn't passed. She knew the moment she came through the main entrance at 6:48, 13 minutes before her shift. The energy in a hospital has a texture to it. She'd learned to read hospitals the way she'd learned to read other environments, by the patterns in the noise, by who was moving and at what pace and whether their eyes were forward or sideways. This morning the pattern was wrong. 2 nurses near the station stopped talking when she walked past. Not rudely. Almost the opposite of rudely, the way people stop talking when someone enters a room and they've been talking about that person. She got her assignment, checked her patients, made her first round. Room 412, post-op gallbladder. Room 407, cardiac monitoring. Room 419, overnight admit, dehydration, elderly male with confusing secondary labs that Emma flagged for the attending and then double-checked herself quietly because the pattern in those labs bothered her. She was in the corridor outside 419 when Dale Ostrowski appeared at the far end of the hall and stopped walking when he saw her. He stood there for a moment, then came over. "You doing okay?" he said. First thing out of his mouth. "I'm fine." "How's Webb?" "Holding. They're watching his pressure." Ostrowski looked at his hands, then back up. He was a big man, slow-moving, the kind of person who chose words carefully because there weren't always enough of them. "I've been doing this for 20 years, he said. "I've worked with surgeons from 4 different countries." "Last night," he stopped. "I know," Emma said. "No, you don't." He kept his voice low, but there was something in it. That technique, the arch compression. "I've only ever seen that referenced in 3 places. 2 of them are military medical manuals that aren't publicly available. The third is a case report from an operation overseas, redacted, that I read about in a journal because I follow fringe trauma literature for fun." He looked at her steadily. "The operative who used it was listed as KIA 8 years ago." The corridor felt very quiet. "Ostrowski," she said, "I'm not saying anything to anyone." He held her gaze. He exhaled. "I'm glad Webb is alive. That's all I'm saying." He walked away. Emma stood in the corridor and watched him go and felt the particular cold calm that settles when a situation has already moved past the point where pretending will help. She needed to think. She needed to think fast. The meeting with Hale was at 10 o'clock, called by administration and framed as a standard post-incident review, which was the kind of language hospitals used when they needed to do something and wanted to avoid saying exactly what. Emma had received the calendar notification at 8:30 via the internal system. She attended. The conference room held Hale, Sung, the hospital's legal affairs coordinator, a thin man named Garrett who looked perpetually braced for impact, and Hale's PA, who took notes. Hale didn't look at Emma when she entered. He waited until everyone was seated, and then he began, and his voice had the quality of controlled anger, the kind held behind institutional language. "Last night, a non-physician staff member intervened in an active surgical procedure without invitation, without authorization, and in direct contravention of my declared termination of treatment," he said. "This represents a serious breach of protocol and an extraordinary liability exposure for this institution." "The patient is alive," Emma said. "That is not the point under discussion." "It seems like the main point." Hale's jaw moved. "Your qualifications are on file. Do not include the right to override a senior surgeon's clinical judgment in an OR. What you did last night was illegal. It was reckless. And I want it on record that I am formally requesting your immediate suspension pending review." Emma looked at him. She had been looked at by harder men than Victor Hale in smaller rooms than this one, and she was still here, and he was not as frightening as he appeared to himself. "You declared time of death on a patient who was not dead," she said. "I can speak to that calmly, and I'd encourage everyone in this room to think carefully about which of those 2 facts carries more legal weight." Garrett made a small sound. Hale's face went through several expressions very quickly. He settled on the controlled one, but it cost him. "This isn't a debate." "No," Emma agreed. "It's a review. And the review should include the OR footage, Mr. Webb's post-repair imaging, and the anesthesia record, all of which will confirm the sequence of events." She folded her hands on the table. "I'm not trying to damage anyone. I'm telling you what happened." Sung had said nothing. She was watching. "Your suspension," Hale said, "is not negotiable." "On what grounds?" "Unauthorized medical procedure. I provided emergency assistance when a licensed physician had vacated the patient." Emma kept her voice level. "You can consult your legal team on how that's classified. I believe they'll have some thoughts." Garrett was typing fast. This was not, his face said, how he'd expected this meeting to go. Sung spoke for the first time. "I'm recommending we table the suspension pending a full review of the OR documentation. 24 hours. She looked at Hale. "That's my recommendation." Hale looked at Sung for a long moment. He nodded once, tightly. Emma was dismissed. She walked back to her floor, collected her things from her locker, and knew with the certainty of long experience that 24 hours was not a delay. It was a window. She needed to use it. What she didn't know yet was that 3 floors up, in the cardiac ICU, Marcus Webb had woken up. He'd come out of the anesthesia slowly, which was normal, and he'd oriented to place and time with the slightly dazed cooperation of a man who'd been very close to somewhere else and was still deciding how he felt about being back. The ICU nurse had done her assessment, noted his responses, called the attending, charted everything. And then Marcus Webb, who was supposed to be resting, had asked the ICU nurse a question in a voice so quiet she had to lean in to hear it. "The woman," he said, "dark hair. She was in the room. He stopped, looked at the ceiling, tried again. "She said something while I was—" Another pause. "While it was happening." The nurse wasn't sure what he meant. He'd been unconscious. He shouldn't have been able to hear anything. "Is she here?" he asked. "I need to. There's something she needs to know, something I have with me." His hand moved toward his jacket, which was not here, which was in a labeled bag in storage, and then fell back. "My jacket pocket," he said. "There's a document. I need to know it's still there." The nurse flagged it as confusion, post-anesthesia, documented it, and moved on. But the paper was still in his jacket pocket in storage, where it had been since he came in. And on that paper, beneath the yellow and blue crayon marks that his 8-year-old daughter had made on the back, was a photograph, printed small and precise, of a document that 11 people in this country knew existed. 3 of those people wanted Marcus Webb dead. The 4th was somewhere in this hospital. She just didn't know it yet. But she was about to. Emma had made it as far as the stairwell on the 3rd floor when her pager went off. The unit's general alert tone, not her personal code, which meant it wasn't directed at her specifically. She checked it out of habit. ICU Level 2. Room 308. Marcus Webb's room. She stood on the landing for 3 seconds, listening to the alert repeat, then turned around and went back up. The ICU on the 4th floor was already moving by the time she pushed through the doors. 2 nurses converging on 308, the attending on call somewhere behind her, someone paging respiratory from the station. Emma stayed back, outside the glass, and watched. Webb was awake. That was the first thing she registered. He wasn't crashing. His monitor showed elevated heart rate, not arrhythmia, not arrest. He was awake and trying to sit up, which was the problem, because a man who'd had his aorta repaired 14 hours ago had no business trying to sit up, and the ICU nurses were managing the gap between his urgency and their instructions with the particular exhausted patience of people who'd done it before. "Sir, you need to stay still. My jacket." His voice carried through the glass, rough with sleep and anesthesia. "I need my jacket. There's something in the pocket. Everything's been secured. Your belongings are safe. You don't understand." He got one arm free, not much, just enough to push against the bed rail. "There's a document, a photograph. I need to know it's there." Emma watched his face. She was good at reading faces under pressure, a skill she'd developed over years in circumstances that didn't allow for misreading. And what she saw in Webb's face wasn't confusion. It wasn't the foggy urgency of post-anesthesia disorientation. It was clarity. He knew exactly where he was and what he was asking for, and the fear underneath it was the clean, specific fear of a man who understands what he's carrying and what losing it would mean. She pushed through the door. "Mr. Webb." He found her immediately. His eyes were sharper than they had any right to be, and they fixed on her with the recognition of someone who'd been waiting, which made no sense because as far as he knew, he'd been unconscious when she was in that room. "You," he said. "You were there. You need to lie back." She was already at his bedside, one hand at the bed rail, calm the way she got calm when something required it. "Your repair is holding, but your pressure is climbing, and you're going to undo 12 hours of work if you keep fighting this bed. My jacket is in storage on this floor, tagged and sealed. It hasn't been touched." He held her eyes for a moment, then let himself be guided back against the pillow. His breathing slowed by degrees. The nurse across from Emma shot her a look that was equal parts gratitude and bafflement. "How do you know that?" he said. Not accusatory. Careful. "I checked your intake log when I came in." She hadn't. She'd seen the storage cabinet through the window when she entered and made a reasonable inference, which was close enough. "Your belongings are secure." He exhaled. Long, controlled. A man practicing patience with himself. "I need to talk to you," he said. "Not them. You." I'm a scrub nurse, Mr. Webb. I'm not your... I know what you are. He said it quietly, without drama, and something in the flatness of it made the sentence sit differently than it should have. I know what you were. Before. The monitor tracked his heart rate. Emma didn't move. You can rest, she said, keeping her voice exactly level. We can talk when you're stronger. No. He closed his eyes briefly, opened them. We can't, because whoever put me in this hospital is going to figure out I'm not dead, and when they do... He stopped himself. Looked at the other nurse, still in the room, charting. Looked back at Emma. She understood. I'll check back in an hour, she told him, and then, to the nurse, flag me if his pressure climbs above 140. I want to know before the attending. The nurse nodded without questioning it. Emma had that quality, the ability to issue instructions that sounded like the natural order of things. And Emma walked back out into the corridor and stood for a moment with her hand flat against the wall, very still, while the implications of what Marcus Webb had just said rearranged themselves inside her head. Whoever put me in this hospital, not whoever caused the accident, whoever put him there. She used the next 40 minutes the way she'd learned to use small windows of time, efficiently, without wasted motion. She found an unoccupied consultation room on the 3rd floor, sat down at the desk, and began pulling what she could from the hospital's internal system without triggering an access flag. Webb's intake record. The accident report attached to his chart. The responding paramedic's notes. The accident itself was documented as a T-bone collision at the intersection of Harker Road and 5th, 21:04 Thursday evening. Other driver fled the scene. No witnesses listed. The responding officer's report was brief. Single vehicle impact, passenger side origination, high speed, and contained one detail that Emma read twice, then a third time sitting with it. No skid marks. At a signaled intersection at 9 in the evening, with the impact force consistent with a vehicle traveling at least 60 miles per hour into a 35-mile zone, no skid marks, meaning the other driver hadn't braked, hadn't reacted, had maintained speed through the intersection and into Webb's driver's side door with the kind of deliberate, unwavering trajectory that was not an accident. That was the first thing. The second thing was the jacket. She thought about what Webb had said. A document. A photograph. Said with the specific urgency of someone who'd been carrying something important long enough to understand exactly what its loss would cost. The kind of urgency that didn't come from general anxiety. It came from knowing. From having thought through the scenarios already and arriving at the hospital with the calculation already made. If something happens to me, this needs to survive. She logged out of the system, pushed the chair back, and sat for a moment with her hands in her lap. 11 months in Ashford City. She'd been careful. She'd kept her head down and her bag packed and her name clean. And she'd been very nearly successful at being nobody. One night in an operating room had undone most of that. And now a man in the ICU who shouldn't know anything about her was saying, I know what you were. And somewhere outside this hospital, there were people who'd aimed a car at Marcus Webb at 60 miles an hour and hadn't braked. The window she'd had since the morning meeting had just gotten shorter. She went back to Webb at the 50-minute mark, not the hour. The other nurse had rotated out for a break. Emma closed the door behind her. He was more alert than before, sitting up slightly, the color better in his face now that his pressure had stabilized. He watched her come in with the focused attention of a man rationing his energy carefully. You've been doing research, he said. I've been doing my job. She pulled the chair from the corner and sat down beside the bed, close enough to keep her voice low. You said you know what I was. That's a strong claim from someone who was unconscious when we met. I wasn't always unconscious. He shifted, careful of the lines attached to him. When they brought me in, the bay. You were there when they rolled me in from the ambulance. I was still conscious. She'd been in the corridor. She'd fallen into the group without thinking, reading the monitor. She'd been visible. I recognized you, he said simply. It took me a while. I wasn't in great shape, but I recognized you. You don't know me. Not personally. He met her eyes. But I've been looking at photographs of you for 6 months. The room was very quiet. My name is Marcus Webb, he said. I'm an investigative journalist. I work for the Callaway Tribune, which is a small paper that nobody reads, which has been very useful lately. A brief, humorless pause. I've been investigating Verano Solutions for 8 months. Environmental dumping, falsified safety reports, regulatory fraud. The kind of thing that's been killing people in Greenvale County for 4 years while the executives collected performance bonuses. He watched her face. The trail goes further than the company. It goes into federal oversight. People who were paid to look the other way. Emma said nothing. One of the people who was paid to look the other way, Webb continued, was a program director in a classified military environmental assessment operation. Overseas, about 9 years ago. His voice was steady, not dramatic. The voice of a man who'd rehearsed what he was carrying for a long time. The operation was shut down suddenly. The assessment team was extracted. One member of that team filed an internal report about what they'd found. Environmental data that contradicted the official position, evidence of deliberate contamination cover-up that the program director was paid to suppress. He paused. That team member was listed as KIA in a vehicle accident during extraction. Her name was Lieutenant Ilara Voss. The monitor tracked Webb's heart rate. Emma watched it. "The photograph in your jacket," she said. Her voice came out level, which required effort. "Is a reproduced page from her original internal report, time-stamped, signed, irreproducible. It connects the current Verano Solutions executives directly to the same program director, who is now a Verano board member, and documents the contamination decisions that started the Greenvale deaths." He looked at her with the careful steadiness of a man who'd arrived at a very important moment. "I had 2 copies. One is with my editor in a sealed envelope. The other is in my jacket pocket." Emma sat with that for a moment. "You think whoever ran that vehicle into you knew what you were carrying," she said. "I think someone at Verano found out I was close. I think they decided a traffic accident was cleaner than the alternatives." He exhaled. "I was wrong about the cleanness. And the photograph connects them to a dead woman." He held her eyes. "Except she's apparently not dead." Emma stood up. She moved to the window, not looking out. There was nothing to look at, just the ventilation housing on the next wing, but putting space between herself and the weight of what was sitting in that room. 9 years. She'd been careful for 9 years. Ashford City was the 6th place, and she'd chosen it specifically because it was medium-sized and forgettable and had a hospital that needed experienced scrub nurses without asking too many questions about where they'd trained. One night, one man dying on a table who didn't have to die. She turned back around. "I need to see the photograph," she said. "Then get my jacket." The personal belongings storage was a locked room adjacent to the ICU nursing station, managed by the charge nurse with a key she kept on a retractable clip. Emma borrowed it with the kind of casual, administrative confidence that tended not to generate questions, signed the access log, and retrieved Webb's jacket from the labeled bag without touching anything else. The crayon drawing was on top, visible through the clear plastic of the bag, yellow and blue. The marks of a child working with a particular kind of seriousness, covering the page fully. Emma didn't look at it longer than necessary. She unzipped the bag and found the folded paper in the inside breast pocket, exactly where Webb had said it would be. She unfolded it in the storage room, under the fluorescent light, and looked at it for 90 seconds. It was a photograph of a document page. Single-space text, official header partially visible, the signature at the bottom legible if you knew what you were looking at. She knew what she was looking at. The timestamp in the upper corner, she remembered the timestamp. She'd written that report in a tent in the Karate Basin with a headlamp and a dying laptop battery, and the specific focus of someone who understands they're probably not going to make it out, but who needs the document too. The report she'd believed had been destroyed. Her handwriting at the bottom. Not a facsimile, not a reconstruction, her actual handwriting, photographed from an original page. She refolded it, put it back, resealed the bag the way it had been, signed out, returned the key. She walked back to Webb's room and sat down in the chair. "I need to make a phone call," she said. "Okay. And I need you to tell no one that we've spoken, including the hospital staff." He nodded. "There's something else." She looked at him. "My editor has the second copy," he said, "but I haven't been able to reach her since yesterday. Before the accident, she confirmed receipt of the envelope. After..." He stopped, tried again. She's not answering her phone or her email. Her assistant says she called in sick this morning, which she hasn't done in 3 years. Emma absorbed that. The people who did this aren't waiting, Webb said. They know I survived. They're going to move fast. I know, Emma said. She left the room, went down 2 flights to the 2nd floor, found the payphone she'd noted on her first week of work, another habit, and stood with the receiver in her hand for a moment. Then she dialed a number she hadn't dialed in 4 years. It rang twice. Then a voice she recognized, older now, rougher, said, "This line isn't secure." "Neither is the situation," Emma said. "I need 12 hours and a contact at federal level. Environmental fraud, corporate conspiracy, at least 1 attempted murder, possibly 2. A pause. "You've been quiet a long time," the voice said. "I'm aware. You're sure about the federal level?" The board connection goes up. Someone in oversight was paid. "I have documentation." She paused. "I am the documentation." Another pause, longer. 12 hours, the voice said. "Stay visible. Don't run." She hung up, stood for a moment with her hand on the receiver cradle, then walked back upstairs. The problem was hail. She'd known it was going to be hail since the morning meeting, but knowing a problem is coming and having it arrive are 2 different experiences. And hail arrived at 2:15 in the afternoon in the form of an HR notification sent to her hospital-issued pager. Effective immediately, access card deactivated pending suspension review. Please report to HR to surrender your badge. Emma read it twice. She was in the corridor outside the 4th floor ICU. She had Marcus Webb 2 rooms behind her, conscious and carrying information that multiple parties wanted suppressed. She had a contact making calls on her behalf who needed 12 hours. She had a personal belongings bag in a storage room that contained the only physical evidence she'd seen in 9 years that her report hadn't been entirely buried, and she now had no institutional access to any of this. She thought about her options the way she thought about everything operational, quickly, without sentiment, ranking by probability and consequence. She could push back on the suspension, which would require a meeting and time she didn't have. She could ignore it and continue working, which would create an incident within the hour. She could appear to comply while staying in the building. She chose the 3rd option. She went to HR, surrendered her badge with the pleasant cooperativeness of someone who has nothing to fight about, and was escorted to the main entrance by a security guard named Pete, who apologized twice during the walk and told her it was just procedure, which she told him she understood, which she did. She walked out the front entrance. She walked around this building to the staff parking structure entrance on the east side, used the secondary entrance code, still valid because HR had deactivated her badge but not yet updated the parking structure system, a 12 to 24-hour lag she'd noticed during her first month, and came back into the building through the service corridor on the 2nd floor. She went to the supply room on 2, changed into a set of surgical scrubs from the clean linen cart, and took the back stairwell to 4. It was not a graceful solution. It was the available solution. She was 20 feet from Webb's room when she heard the voices. She stopped. The door to 308 was slightly ajar. It should have been latched. The ICU doors were always latched. And through the gap she could hear 2 voices, one of which was Webb's and one of which was not. The second voice was male, moderately pitched, and careful in a way that medical professionals weren't usually careful with ICU patients. Medical professionals were calm. This was something different. This was controlled. Emma moved to the side of the corridor out of the sightline of the door and listened. "Just need a few minutes of your time," the voice was saying. "I know you're tired. We can keep this very brief." "I don't have anything to tell you," Webb said. His voice was measured. He was managing. "You came in with personal belongings, a jacket. We're trying to make sure everything was properly documented in the intake process. I was told my belongings were secured. They are, absolutely. We're just doing a routine follow-up." Emma had heard a lot of lies in a lot of registers, and this one had the particular smoothness of a lie that had been prepared rather than improvised. Nobody from hospital administration did routine follow-up on ICU patient belongings. Nobody did it at 2:30 in the afternoon on a Friday, and nobody did it in street clothes. She could see the shoes through the gap at the bottom of the door. Not hospital shoes. Not the flats or sneakers of administrative staff. Dark leather lace-ups, scuff-free. the kind worn by people who expected to be taken seriously. She pulled back further and thought fast. There were two options. She could go in now, walk through that door, and insert herself before the situation developed. But she didn't know how many people were in the corridor, whether there was someone stationed elsewhere in the floor, what the exit was if this went wrong. Going in blind was the fast option, and frequently the dead option, or she could do something smarter. She went to the nursing station. The charge nurse on duty was a woman named Brenda, 50-ish, the kind of nurse who'd seen everything and reacted to none of it, an underrated quality. "There's someone in Webb's room," Emma said quietly. "Room 308. He's not authorized." Brenda looked up from her chart. "You're supposed to be suspended." "I know. There's still someone unauthorized in your ICU." A beat. Brenda put down her pen, picked up the phone, and dialed security. Emma had already moved back toward 308. She went through the door without knocking. The man standing at Webb's bedside was roughly 40, medium build, with the particular blankness of expression that Emma associated with people trained to project neutrality while gathering information. He turned when she entered with the measured reaction of someone who'd been trained not to startle. "This is a restricted unit," Emma said. "Do you have an access wristband?" He looked at her, at the scrubs, the clipboard she'd picked up from the station on the way in. "I'm with hospital administration." "Great. Administration access is green banded. Let me see your wristband." We had a policy update in January. Everyone above the second floor needs a wristband, including administration." She held out her hand. Politely. Absolutely and flexibly. "If you don't have one, I can call someone from the main desk to escort you down and get you one. Takes about 3 minutes." He looked at her hand. He looked at Webb. He looked back at Emma and made the calculation she'd hoped he'd make. That pushing back required escalating the scene, and escalating the scene was not in his interest. "I'll come back," he said. "Of course. I'll let the desk know to expect you." He walked out. Emma closed the door and stood with her back against it. "Are you okay?" she asked. Webb had both hands flat on the bed. He was breathing carefully. "He didn't touch me. He was asking about my jacket." "I know." "He wasn't from administration." "No?" She looked at the door, then back at him. "I need to move you." "Move me?" He said it like he was testing whether she meant it the way it sounded. "Not out of the hospital, to a different room." She was already thinking through the floor plan. 308 is documented as your room in the system. Anyone with access to hospital records can find you here. I need to put you somewhere that isn't in the system. "You can do that?" "Not officially." She pushed off the door. "But the room documentation lag on transfers is about 4 hours if you don't enter the destination into the primary system. I know a room on the 3rd floor that's listed as under maintenance." She paused. "It's not actually under maintenance. The ventilation work was finished Tuesday. It's clean." Webb stared at her. "You've been here 11 months and you know the maintenance schedule. I pay attention." She pulled the IV pole closer. "Can you sit up on your own?" "I can try. That's all I'm asking." She moved him in a wheelchair, which was both the most practical option and the most invisible. People in wheelchairs being moved through hospitals attracted approximately 0 attention, which was the point. She brought him down the back corridor to the service elevator, 3rd floor, the room at the end of the east wing that the maintenance log listed as ventilation repair, do not occupy, and which was, as she'd said, clean. The equipment was minimal. A bed, a monitor she unboxed from the supply closet and connected herself. Basic lines. Not ICU standard, but sufficient for a man who was stable and needed 4 hours more than he needed luxury. She got him situated and connected and checked his pressure, which was holding. "The man in your room," she said. "Did he say anything before I came in? Anything specific?" "He asked if I had family they should notify." Webb's voice was dry. "I have a daughter. She's 8. Emma filed that. "Where is she now?" "With her grandmother, in Prosper Falls." He looked at the ceiling. "I called her this morning. She thinks I'm fine. She doesn't know." He stopped. "She doesn't need to know anything yet," Emma said. 8-year-old girls don't need to know anything about this yet." Something shifted in his face. Not gratitude exactly. something more tired than gratitude. "The people who sent that man," he said, "they're not going to stop." "I know. What are you going to do?" Emma checked his IV line and straightened up and looked at him with the particular directness of someone who has decided, if not what to do with a situation, at least that they're the one doing it. "I'm going to make sure your jacket stays where it is," she said, "and I'm going to make some things very difficult for the people who don't want it to." He was quiet for a moment. "You filed that report in the Karate Basin," he said. Not a question. 9 years ago. She didn't answer. "It's your handwriting," he said, "at the bottom. I've been looking at that photograph for 6 months. The room was still. Somewhere down the hall, something beeped and settled. "Get some rest," Emma said. She went back to 308. The man in the street clothes was gone. Security had checked the floor and found nothing. Brenda had logged it as an unauthorized visitor, which would generate a report that would sit in someone's inbox and probably not be read until Monday. Emma stood in the empty room and looked at the unmade bed where Marcus Webb had been an hour ago, and thought about the photograph in the jacket, and the number she'd called from the payphone, and the 12 hours she'd been promised, and the man in the street clothes who would be making a phone call right now to someone who would not be pleased with what he had to report. She thought about her duffel bag under the bed on Caldwell Street, still packed, and the fact that she'd told her contact don't run, and the difference between not running and staying still. Then she picked up a call button that had been left in the room when Webb was moved and walked back out into the corridor. Her pager went off. She checked it. Not the unit alert. Her personal code, the one she hadn't given to the hospital system because it wasn't in the hospital system. The one only one person in the world had, and that person had told her 4 years ago to only use it if the situation was critical. The message was 6 characters. Blown. Run. Emma stood in the corridor of Riverside Memorial Hospital with the pager in her hand and the service stairwell door 12 feet to her left, and Marcus Webb asleep in an undocumented room 30 feet to her right, and the main entrance 2 floors below her, and she stood very still while she figured out which of these things she was not going to be able to do. She couldn't run. Not because she was afraid, and not because she didn't know how. She couldn't run because the man in 308, the third-floor room that wasn't in the system, didn't know what was coming, and the photograph in the storage room was the only physical evidence that connected 9 years of cover-up to the people who'd been running it, and if she went through that stairwell door and out into Ashford City and disappeared into the next name and the next city, the document would stay in that bag, and Webb's editor would stay unreachable, and the people in the street clothes would eventually find him. She put the pager in her pocket and turned away from the stairwell. Somewhere in this building, the man who'd been in Webb's room was either still here or had just communicated that his search had been interrupted. Somewhere outside it, the people who'd sent him were recalculating. And somewhere in the east side of Ashford City, the person who'd sent her a 6-character warning was either already gone or about to be, and Emma couldn't do anything about that. What she could do was what she'd always been able to do, which was figure out the most important thing in the immediate 10 square feet of her situation and address it. The most important thing was Marcus Webb's IV line. She realized it as she walked back toward the 3rd floor, a detail her brain had logged and then shelved while handling the visitor, now surfacing with the specific insistence of something that matters. When she'd moved him, she'd checked the line quickly, but she hadn't checked it the way she'd check it if she were looking for something wrong. She'd checked it the way you check things when you're managing 5 problems and the line isn't currently the loudest one. She pushed through the 3rd-floor door and moved fast down the east corridor. She went through the maintenance room door and crossed to the bed in 4 steps and looked at the IV line with the full attention she should have given it an hour ago, and what she saw made her stop breathing for 1 complete second. The drip bag was fine. The tubing was fine. The connection at the port was fine, except there was a second port on the tubing, a secondary injection point, standard on all IV setups, and the cap on that port was not the cap that had been on it when she'd set it up. It was the same color, same style, close enough that you'd miss it in bad light, moving fast. Different manufacturer's stamp. Emma reached out and touched the port without disturbing it and felt the faint resistance of a seal that had been broken and recapped. She looked at Webb. Still asleep, still breathing, pressure on the monitor within range. For now. Whatever had been introduced into that port, whatever was sitting in that tubing, not yet through the drip, waiting, was working on a timeline she didn't know. Could be minutes, could be less. She disconnected the line in one motion, capped the patient end, and moved to the door. Webb, her voice was sharp. Wake up, now. He surfaced from sleep with the disoriented haste of a man who'd heard that tone before in his life, not in hospitals, and was already pushing himself upright before he was fully conscious. What? Someone has been in this room, Emma said. I need you to stay awake. Can you do that? He looked at the disconnected IV. He looked at her face. Yes, he said. Good. She was already pulling out the secondary pager, not her personal unit, the one she kept in the inside pocket of the scrub top she'd grabbed from the cart, the one she'd put there the day she started at Riverside Memorial, because the day she started anywhere, she made sure she had a way to communicate that wasn't the official way. She pressed the emergency page code and sent it to the one number she still had for a federal contact, not the one she'd called from the payphone, a different one, older, less reliable, but existing. And then she stood at Marcus Webb's bedside in an undocumented room on the third floor of Riverside Memorial Hospital and looked at the contaminated IV line in her hand and understood that this had stopped being a close call about 20 minutes ago. Someone had gotten into this room. Someone had gotten into a room that wasn't in the system, which meant the man in the street clothes hadn't been working alone, and he hadn't left the building when security checked the floor. He'd moved somewhere else in it, and somewhere in this hospital, in a labeled bag in a locked storage room, was a photograph that people had already attempted murder twice to suppress. Emma set down the IV line and moved to the door and looked both ways down the corridor. The East Wing was quiet. The lights were on their evening dim, the kind of institutional twilight that fell over hospitals at shift change, when one set of people was handing off to another and everyone was tired and thinking about home. At the far end of the corridor, by the elevator bank, a man in hospital maintenance coveralls was standing with his back to her, looking at his phone. He wasn't doing maintenance. Emma had never seen him before, and he was standing between her and the storage room. He wasn't doing maintenance. Emma had 3 seconds to make a decision, and she made it the way she'd learned to make decisions in tight spaces. Not by eliminating fear, but by filing it somewhere that wasn't the front of her mind and moving anyway. She went back into the room. I need you on your feet, she told Webb. Right now. He didn't ask why. He swung his legs off the bed with the careful deliberateness of a man managing pain he wasn't going to mention, and Emma got her shoulder under his arm and took his weight without comment. She disconnected the monitor, saw the alarm would trigger at the nursing station in approximately 90 seconds, which was both a problem and a tool, depending on how she used it. Where are we going? He said, quiet. Stairwell B, east side. That's toward him. I know. She moved them into the corridor and turned left, away from the elevator bank, toward the connecting passage that ran between the east and central wings. The man in the coveralls was still at the far end, still looking at his phone. He hadn't turned. Emma kept her pace measured, not slow enough to look deliberate, not fast enough to look urgent. 2 hospital workers, one assisting a patient, completely normal. The connecting passage door was 30 feet ahead. 20. Behind her, the nursing station on the floor would be getting the monitor alarm now. Someone would be checking the screen, seeing the flat line from a disconnected lead, deciding whether to send someone to the room or call the code. Standard lag was 90 seconds to 2 minutes before physical response. 10 feet. The man at the elevator turned. Emma pushed through the connecting passage door without looking back. The passage was a narrow service corridor, fluorescent, lined with linen carts and an equipment rack that someone had parked at an angle and never straightened. She moved Webb through it fast, his breathing rough but controlled, his hand gripping her shoulder with the grip of a man who understood the situation required him to not fall down right now. There's a second exit at the end of this passage, she said. Maintenance stairwell. It goes to the basement and the ground floor. Basement. Loading dock. There are always vehicles there, and staff who don't pay attention to what's coming in and out because they're managing deliveries. You've thought about this before. Every building I've worked in. She didn't say anything else. They reached the end of the passage, and she pushed through the stairwell door and held it for him, and they went down one flight in the stale air of a stairwell that smelled like cleaning fluid and concrete, and she was listening the whole time. Above them, below them, The quality of silence that either meant empty or meant waiting. It meant empty. She got him to the bottom, pushed through the basement door. The loading dock was exactly what she'd said. 2 vehicles, a supply truck backed up to the bay with its rear doors open, a driver somewhere not visible, a receiving attendant with a clipboard signing off on something at the far wall. The attendant looked up when they came through. Emma met his eyes and nodded once. The universal hospital staff signal that communicated we belong here and we're handling something, and he looked back down at his clipboard. They made it to the far side of the dock, into the narrow corridor that ran alongside the receiving bay to the secondary staff entrance. Emma stopped. "I can't take you outside," she said. "You're not stable enough and we don't have anywhere to go." "I know." Webb was leaning against the wall, both hands braced. His color wasn't good. "The jacket!" "I'll get it." "Emma." He said her name, her real name, or close enough, and the weight of it in his voice was not dramatic. It was the weight of someone who'd been carrying something alone for a long time and had just arrived at the moment where carrying it alone was no longer the option. "The photograph isn't the only thing in that jacket." She looked at him. "There's a USB drive," he said. "Inner lining, sewn in. 8 months of documentation, financial records, communications, the regulatory correspondence, everything." He exhaled. "If something happens to me and they get that jacket, nothing's going to happen to you," Emma said, which was not a promise but was the only sentence available. She left him in the corridor and went back up. The 3rd floor was different when she came back through the stairwell door. The quality of the corridor had changed. More movement, voices from the nursing station, a security guard she didn't recognize stationed near the elevator bank. Not the coveralls man, an actual guard, which meant someone had called it up officially. The storage room was in the opposite direction, east wing, past the nursing station. She walked toward it. The guard clocked her when she was 15 feet away. She kept her pace even, her expression the specific blankness of someone whose badge had been surrendered that morning and who was therefore very aware that she was not supposed to be here, but whose face was not going to say that. "Excuse me." He stepped into her path. Young, mid-20s, the body language of someone who'd received a description. "Can I see your ID? I'm grabbing something from storage for a patient transfer." She kept moving slightly, not pushing past him, just continuing to orient toward the destination. "I was on suspension as of this morning, but Dr. Sung authorized my access for the transfer. You can call her." He had a radio on his hip. He reached for it. Emma stepped past him toward the storage room, natural, unhurried, the way you step past someone who's about to make a call, not someone you're trying to escape. She had her hand on the storage room door by the time he got the radio to his mouth. "I need to confirm authorization for a suspended staff member. 4th..." He stopped. 3rd floor. She was inside. The bag was where she'd left it. She had it open in 4 seconds, the jacket out, and she was feeling along the inner lining before she had a full breath. There. A slight stiffness in the fabric at the lower left seam. She didn't rip it. Ripping fabric takes longer than it sounds and makes more noise than you want. She worked the seam at an existing weak point, the kind that develops in any garment worn and washed repeatedly, and the small drive dropped into her palm. She put the jacket back in the bag, resealed it, set it back on the shelf. Then she put the drive in her left shoe, under the arch, and walked back out. The guard was still on the radio. He looked at her. "Call Dr. Sung," Emma said again, pleasant, not stopping. "She'll confirm." She was at the stairwell door before he made a decision about stopping her. She went through it and back down. She heard it before she reached the basement corridor, a sound that didn't belong in a building and specifically didn't belong in a hospital, which was the sound of a scuffle. Short, physical, the impact noise of a body against a wall. She went through the door fast. The corridor outside the loading dock. Webb on the floor, one shoulder against the wall, conscious but down. The man in the coveralls standing over him. Not the same posture as before, not pretending anymore. The phone gone, his weight forward and his hands at his sides with the particular readiness of someone who'd done this before and wasn't concerned about the setting. He heard Emma come through the door and turned. She had about a quarter of a second to assess him. 2 inches taller, 30 pounds heavier, conditioned in the way that suggested regular training rather than gym habit. He moved to close distance immediately, which was the right instinct, and he was fast. She was faster, but not by as much as she needed to be. She let him come. Stepped inside his reach instead of back from it. The counterintuitive move that trained fighters used and untrained attackers didn't expect, and used his forward momentum and her forearm against his elbow to redirect him into the wall. He recovered faster than she'd calculated, got a hand on her shoulder and threw his weight. She went down on one knee. His knee came up and she got her forearm in the way, which hurt, and then she drove upward from the knee with everything her legs had and got her elbow into his solar plexus as she rose. He folded. Not completely. He was trained enough to manage a partial fold, one hand catching the wall, but enough. She got his arm locked behind him while he was still managing the breath, walked him forward into the wall face first, and held. He struggled for 4 seconds. Then he stopped. "Who sent you?" she said. He didn't answer. "I'm not going to hurt you more than I already have," she said. "I just need to know who sent you." Silence. She checked his pockets one-handed, which was harder than it sounded with his weight against the wall. Phone, locked, no use. A key card, not hospital issue. A folded paper with a room number written on it. 308. Webb's original room, the one that was in the system. Someone had given him that room number, which meant someone with system access. She let that sit for exactly the amount of time she had. "There's a security guard on the 3rd floor who's going to be here in about 2 minutes, she said. "You can talk to me or you can talk to him." He made a sound. Not words, the sound of a decision. "Morrow," he said. "I work for Morrow." She didn't know the name. She filed it. "Who is Morrow?" "Verano's head of operations." She let him go, stepped back, and he slid down the wall to a sitting position, holding his midsection. She looked at him for a moment, the coveralls, the keycard, the folded paper, and understood that he was a contractor, not a true believer. Someone hired for the job, not someone who cared about the outcome, which meant he was going to be easier to manage than she'd feared and less useful than she'd hoped. She picked up Webb. He hadn't lost consciousness. She could see the focus in his eyes, the deliberate management of a man refusing to pass out through sheer stubbornness, and she got him back to his feet and got her shoulder under his arm again. "I heard most of that," he said. "I know." "Morrow. He's in Verano's board communications. He coordinates with the outside contractors." Webb's voice was strained but clear. "He's been the operational link between the executives and the people who—" He stopped for a breath. "The people who arrange things." "I need to get you somewhere with a monitor," Emma said. She was already moving. "Your pressure's been off for the last 15 minutes, and you've been on your feet longer than you should have." "I feel fine." "You feel fine because adrenaline is doing your job for you, and it's going to stop in about 10 minutes, and when it does, I need you horizontal." He didn't argue. She brought him back through the loading dock, up through a different route. Service elevator, 2nd floor. A consultation room she knew was empty on Friday afternoons because it was where the chaplain held voluntary sessions that nobody attended. She got him onto the examination table, pulled the portable BP cuff from the shelf, and checked him. His pressure was lower than she wanted. Not dangerous, but trending. She needed an IV line, and she'd left the compromised one 3 floors up. She thought through what was in this room. Standard consultation room, no equipment beyond the basics, nothing she could use for vascular access. "I need to get you a clean line," she said. "Can you stay awake?" "Yes, I mean it. Stay awake and stay talking. Tell me about your daughter." He blinked. "What?" "Her name, age, what she drew on the back of that document page." A pause. Then something shifted in his face. The exact shift she'd intended, the one where a person stops managing the crisis for a second and steps briefly into something human and warm. "Lily," he said. "She's 8. She draws houses." A rough exhale, almost a laugh. "Always houses. She draws the same house over and over, slightly different every time. I don't know why." "Kids do that," Emma said. "They're working something out." She left him talking to himself, or more precisely, she left him with the instruction to keep talking, which he followed in the slightly disconnected way of a man who is maintaining consciousness through the discipline of following instructions. and went down the corridor to the supply room on 2. She was reaching for the IV kit on the 3rd shelf when her phone vibrated. Not the personal pager. Her actual phone, the prepaid one she'd had for 3 months. And the number on the screen was not one she'd given to anyone, which meant the person calling it had gotten the number through channels that were not simple. She answered. Ms. Voss. A voice she didn't recognize. Male, measured, the tone of someone accustomed to being listened to. My name is Callahan. I'm with the Federal Bureau of Investigation, Organized Crime Division. I've been trying to reach you for 4 years. Emma stood in the supply room with the IV kit in one hand and her phone in the other and said nothing for a moment. I know this is a lot, Callahan said. I'll be brief. We have a vehicle 2 blocks from Riverside Memorial with 2 agents. We've been monitoring Verano Solutions for 18 months. We know about Marcus Webb. We know about the document he's carrying. And we know that the situation in that building has escalated to a point where we can no longer hold our position outside. A beat. I need you to tell me what floor you're on. She thought about the 6-character warning on her pager. Blown. Run. Thought about who had that number and what blown meant in this context. Whether the contact had been identified, whether the contact had told anyone what he knew before going, whether the people who'd identified him now knew more about her than they'd known this morning. 2nd floor, she said. Stay there. We're coming in. There's a man in the basement east corridor, she said. Contractor. He needs to be detained. And the personal belongings storage on the 3rd floor, room 312. There's a bag tagged to Marcus Webb that needs federal custody immediately. Don't let hospital security touch it. A brief pause. Understood. And Agent Callahan. She kept her voice even. Before you come in, check whether you have a Morrow on your radar. Verano operations. He has someone inside this hospital with system access. Another pause. Longer. We do have a Morrow, he said. Then someone in your building has been talking to him. She said it without accusation. Just fact. Figure out who before you walk your agents in, or you're going to have a problem the moment you announce yourselves. Silence on the line. 10 minutes, Callahan said. She hung up, put the IV kit under her arm, walked back to the consultation room. Webb was still talking. He'd moved from Lily's house drawings to a description of a camping trip they'd taken the previous summer, rain the entire weekend. They'd eaten canned soup for 2 days, and she'd declared it the best vacation of her life. His voice was slower than before but present. Emma set up the line. Found a vein on the first try, taped it clean, got fluids running. How are you feeling? She asked. Like I need about 48 hours of sleep. You'll get it after. After, she agreed. She sat down in the chair beside the table and felt, for the first time in hours, the specific exhaustion that comes not from the body, but from the part of the brain that manages sustained threat and then receives the first signal that the threat might be changing shape. It wasn't over. She knew it wasn't over. Callahan's 10 minutes was a number, not a guarantee. And someone inside this hospital with system access was still inside this hospital. And the man in the basement might or might not stay put. And Webb's pressure might or might not hold. But the next move wasn't hers to make alone. And that was different from what it had been an hour ago. She checked her watch. 8 minutes. There are federal agents coming into the building, she told Webb. He opened his eyes. When? 8 minutes. Maybe less. He was quiet for a moment. You called them. I called a contact who called them. They were already watching Verano. But they didn't know where I was. They do now. He exhaled. Okay. Then, are you going to be here when they arrive? Emma looked at the IV line, steady, dripping, looked at the door, closed, the corridor beyond it, quiet. I'll be here, she said. She almost meant it. The lights in the corridor outside went out. Not a flicker. Not a section. The entire 2nd floor east wing, dark, simultaneously, the way power goes when someone cuts it deliberately, rather than when a breaker trips from load. The emergency backup lighting kicked on in 4 seconds. Low, red-tinted, the kind of illumination that lets you see shapes but not details. Emma was already at the door. She opened it and looked down the corridor in both directions. and in the red-tinged dark she could see three things: the stairwell door at the far end, the elevator bank in the middle, and, moving toward her from the direction of the stairwell, fast, not trying to be quiet anymore, two figures she had never seen before. Behind her, Marcus Webb's monitor let out the flat, continuous tone of a system losing power. And somewhere below them, in the lobby of Riverside Memorial Hospital, she heard, or felt, the way you feel it in the sternum before you hear it with the ears, the sound of multiple vehicle doors opening at once. She counted the two figures in the corridor and made a fast, cold calculation. She had approximately 8 seconds before they reached the consultation room door, a patient behind her who could not run, a dead monitor, and no backup in the building that she could confirm. 8 seconds was enough. She pulled the IV pole from beside Webb's table, aluminum, 5 feet, weighted at the base, and positioned herself at the door rather than behind it. Not hiding, waiting. The difference mattered tactically because people who open doors expecting resistance look at the space behind the door first, and the half-second it took them to reorient was the half-second she needed. The first figure came through fast. She stepped into him, used the pole across his forearms to drive them up, and put her knee into his thigh, not the groin, which people expected, which people braced for. And when he buckled, she got the pole across the back of his shoulders and brought him down to the floor with enough controlled force to keep him there without producing the kind of impact that breaks things. He stayed down, not unconscious, winded, disoriented, processing what had just happened. The second figure stopped in the doorway. He was smarter than the first one. He'd seen it happen, and he'd stopped, which meant he was assessing rather than reacting, and that was a different problem. He was also bigger, and he had something in his right hand that the emergency lighting caught at an angle, a compact case, medical-looking, the kind that held syringes. Emma looked at it, looked at him. "That's not a weapon," she said. "You're not here to shoot anyone. You're here to finish what the IV line was supposed to do." He didn't answer, but his eyes shifted slightly. The microscopic tell of someone whose plan has been named. "The building has federal agents in it," she said. "They're already through the lobby." She kept the pole between them, not raised, just present. "You can put that down and we can wait for them together, or you can make a choice that makes everything worse for you specifically." A long, bad moment. He put the case on the floor. "Kick it toward me," she said. He did. She picked it up without taking her eyes off him and stepped back into the room. Behind her, Webb had gotten himself upright on the table. She could hear the shift of his weight and his breathing, controlled, the breathing of someone managing pain and refusing to mention it. "There are zip ties in my right scrub pocket," she said, not turning. "Can you reach them?" A beat. Then, "Yes." "Toss them here." She heard the small effort of him leaning, the rustle of fabric, and the ties landed near her right foot. She picked them up and looked at the two men, one on the floor, one in the doorway, and said, "You're going to do this yourselves. Wrists in front, tight enough that I can see the tension. You know how." They did know how, which confirmed what she'd suspected about them. She stood back and watched them secure themselves and thought about the syringe case in her hand and what was in it, and whether the contaminated IV line was still on the 3rd floor where she'd left it, and whether Callahan's people were going to find it before someone else did. The lobby sounds had changed. She could hear movement in the stairwell, multiple people, not trying to be quiet, the particular organized noise of a team that knows exactly where it's going. The consultation room door opened from the corridor side, and 2 people came through in tactical vests, weapons drawn, and cleared the room in the practiced way of people who cleared rooms professionally. The first agent looked at Emma, looked at the 2 men zip-tied on the floor, looked at the IV case in her hand. "Are you Emma Carter?" he said. "Close enough," she said, and handed him the case. "Attempted poisoning via IV access. The original contaminated line is on the 3rd floor. Room 308 is empty. Patient was moved. I'll walk you through all of it, but first someone needs to get a portable monitor in here and check this man's pressure." The agent stared at her for 1 second. Then he turned and spoke into his radio. "Jamats." Callahan was not what she'd expected from his voice. He was shorter than the voice suggested, mid-40s, with the kind of face that had been lived in hard without becoming hard. Lines around the eyes that came from squinting at documents more than from sun. a jacket that fit well but had been worn too many times without dry cleaning. He came through the consultation room door 4 minutes after his agents, assessed the room in one sweep, and then looked at Emma with the particular attention of someone who'd been building a file on a person for a long time and was now encountering the actual person. "Callahan," he said. "I know," she said. "You moved the patient without logging the transfer." "I moved the patient because someone with system access had given his room number to a contractor." She kept her voice even. "I'd do it the same way again." He held her eyes for a moment. "Fair." He pulled a chair, sat down uninvited, and put a tablet on the examination table between them. "I want to walk through the timeline. Everything from last night. We have footage from some of it and gaps in others, and I need your account before you talk to anyone else." "Before I talk to anyone else?" Emma said. "I need to know about the internal access. Someone in this hospital gave Webb's room number to the contractor. I need to know who." "We're working on it." "I need to know before I give you a timeline." Callahan looked at her. Whatever he found in her expression, he made a decision. "The access log on the patient transfer system shows 2 entries after Webb was admitted," he said. "One was Dr. Patricia Sung, which is expected. The other was made at 14:47 this afternoon from a terminal registered to the surgical department." He paused. "The login credentials belong to Dr. Victor Hale." The room was quiet. Emma sat with that for a moment, not surprised. She had thought surgical department the moment Callahan said system access. But there was a difference between a working theory and confirmation, and the difference had weight. "He's been suspended pending review," she said. "His credentials weren't suspended, just his badge access." Callahan's voice was dry. Someone in HR made a distinction. Someone who didn't understand how the system works, or someone who understood exactly how it works. "We're looking at both options." She nodded. "Hale doesn't care about Verano Solutions. He cares about being embarrassed. Someone contacted him and offered him something in exchange for access." She thought about the morning meeting, the controlled anger, the precision of a man whose ego had been publicly challenged. He wouldn't need to know what it was for. He'd just need to feel like he was winning something. "That's consistent with what we're seeing in his financial records," Callahan said. "A transfer this morning, small enough to look like nothing, not small enough to be nothing." He looked at her. "You understand we're going to need your full name on record." "I know." "And your service record, whatever parts of it can be declassified." "I know," she said again. "I'll give you everything, after you tell me that the storage room on the 3rd floor is in federal custody, and those 2 men are in custody, and Marcus Webb has a working monitor." Callahan looked past her to the agent by the door, who nodded once. "All 3, Callahan said. Emma exhaled. Not dramatically, just the exhale of someone who has been holding something for a long time and has just been given provisional permission to put it down. "Then let's talk," she said. The timeline took 2 hours. She gave it the way she gave everything operational, chronologically, precisely, without editorial. She told him about the repair, about Ostrowski's recognition, about the morning meeting and Hale's suspension request. She told him about Webb waking up and what he'd said, about the man in the street clothes and the contaminated IV port and the drive sewn into the jacket lining. She told him about the payphone call and the 6-character warning and the coveralls contractor in the basement corridor. She told him about the karate basin. Not everything. Some of it was still classified, and she said so, and Callahan noted it and moved on. But enough. The assessment operation, the contamination data, the program director who'd been paid to suppress it, the internal report she'd filed and the extraction that had gone wrong, and the 9 years she'd spent being someone different in 6 different cities. Callahan listened. He asked 2 clarifying questions, both precise. He didn't fill silences with reassurance, which she appreciated. When she was done, he looked at his tablet for a moment, then at her. "The program director," he said. "Reeves. He's on the Verano board." "I know. He's been on our radar for the contamination case, but we couldn't connect him to the original suppression without the report." He paused. "The photograph Webb had, if it's authenticated." "It will authenticate," Emma said. "It's my signature, my handwriting, my formatting. Any document examiner will confirm it." "And the drive?" 8 months of Webb's reporting, financial records, communications. If it's what he says it is, you have the Verano executives, Reeves, the regulatory officials who were paid, and the operational chain that ordered the hit on Webb. She folded her hands. That's your case. Callahan nodded slowly. We're going to need you to testify. I assumed. And we're going to need to deal with your status. 9 years is a long time to be administratively deceased. I know. She looked at the wall, then back. One thing at a time. Fair, he said again. He stood, straightened his jacket, and then paused at the door. The two men from the corridor, the one from the basement, they're all contractors. Private security firm, Verano adjacent. The contractor from the basement gave us Morrow's name. He looked at her. He also told us something else. She waited. Morrow wasn't the one who found Webb's location, Callahan said. Morrow was told, by someone who was told by someone at Verano who was watching Webb's byline for 8 months and started tracking his movements 3 weeks ago. He paused. They didn't find you until last night, until the OR. The weight of that landed in exactly the way she'd known it would. Eventually, when she'd shoved Hale aside and put her hands in a dead man's chest. My repair technique, she said. Someone with a connection to the military medical community saw the incident report that Hale filed this morning, recognized the description of the procedure. Callahan's voice was careful. That's how fast it moved. 6 hours from Hale's report to a contractor in your hospital. 6 hours. She'd had approximately 6 hours from the moment she chose not to let Marcus Webb die before the people she'd been hiding from for 9 years knew exactly where she was. She sat with that. She'd known, on some level, had felt it last night in the corridor after Ostrowski spoke to her, the specific cold of something that can't be undone. He was dying, she said, not defensively, as a statement of record. I know, Callahan said. I'd do it the same way again. He looked at her steadily. I know that too. He opened the door. Get some rest. We'll need you in the morning. Ma. She didn't rest. She found a family waiting room on the first floor that was empty at this hour, sat down in a chair with inadequate cushioning, and let herself be still for a while. Not sleeping, not exactly thinking. The particular state that exists between those things when a body has been running on adrenaline for 7 hours, and the adrenaline is leaving. She thought about the drive in her shoe, which was now in an evidence bag. She thought about Webb's daughter drawing houses over and over, working something out. She thought about Dale Ostrowski saying like watching someone who'd done it in the dark, for real, with people shooting at them, and the fact that he'd meant it as a compliment, and the fact that it was accurate. At 11:40, an agent she didn't recognize knocked on the waiting room door and told her that Marcus Webb's pressure had stabilized and that he'd been moved to a monitored room with federal security outside the door, and that the storage room on the 3rd floor had been officially transferred to federal evidence custody, and that 4 arrests had been made in the building, including the coveralls contractor and both men from the corridor. She thanked him. He left. At 12:15, Patricia Sung came through the waiting room door. She looked like a woman who'd been in her office for the past 3 hours fielding phone calls she hadn't expected to be fielding, which she had been. Her jacket was still on, but her posture had the specific exhaustion of a person managing something larger than their usual category of problem. She sat down across from Emma. For a moment, neither of them said anything. I owe you an apology, Sung said finally. This morning, in the meeting, I recommended tabling the suspension instead of blocking it outright, and I told myself that was being measured. She paused. It wasn't. It was being cautious in a way that served me more than it served you. Emma looked at her. You bought me 24 hours. I bought myself 24 hours. It amounts to the same thing. Emma meant that. It wasn't generosity. It was accurate. Whatever Sung's motive, the delay had been the window. You didn't know what you were managing. I should have trusted what I saw in the OR. Sung's voice was level, the way it got when she was being precise. What you did last night, I've been in surgical services for 17 years. I've never seen anything like it. She paused. And I told myself it was a liability question. Emma didn't fill the silence. Hale's credentials, Sung said. The system access. I didn't know about that until the agents told me an hour ago. I didn't think you did. He used the surgical department terminal, his login. Sung's jaw was tight. He sold Webb's location for $40,000 and access to a recommendation letter for a position in Carver City he's been angling for. She exhaled. $40,000 and a professional favor. It was almost too small a number to be real. That was always the way with it. The people who sold important things always sold them for less than the stakes warranted. What happens to him? Emma asked. Federal charges for obstruction and accessory. His license is under emergency review. The board was notified at 10 o'clock tonight. Sung's voice was flat and certain. He won't practice medicine again. Emma nodded. Sung looked at her for a long moment. The agents told me who you are. Not everything. They said classified, but enough. She paused. Emma Carter. Ilara Voss. Whoever you are. I'm working on figuring that out, Emma said. Something moved in Sung's expression. Not pity, which Emma didn't want, but something more like recognition. I'm going to recommend you for the trauma specialist position when this is over, when the review is complete. Emma looked at her. You saved a man's life last night. You kept him safe tonight when the institution failed to. Whatever your credentials say, I know what I saw. Sung stood. You shouldn't have to hide what you are. She left. Emma sat in the inadequate chair and looked at the empty doorway for a while. The morning came gray and slow, the particular gray of a city that hadn't decided what kind of day it was going to be yet. Emma had slept for 3 hours on the waiting room couch. Not well, but enough. And was on her second cup of vending machine coffee when Callahan appeared at 7:20 with a younger agent and the expression of someone who had news. She could read news. She'd learned to read the quality of it before people delivered it. This was the complicated kind. Webb is stable, he said, which was the first thing, and the right first thing. His pressure normalized overnight. The attending is talking about a full recovery timeline. He sat down. We executed arrest warrants at 6 this morning. 3 Verano executives, including the CFO and the head of regulatory affairs. Reeves was taken into custody at his home in Hartwell County at 6:12. He looked at her. The 4th arrest was Morrow. That's 4, Emma said. That's 4. As Callahan set his tablet on the table between them. The USB drive has been partially decrypted. Webb's documentation is extensive, thorough. 8 months of work, and he was thorough. A pause that had something in it. There are also emails on there that we didn't expect. Communications between Reeves and a contact in the Department of Environmental Standards, a federal oversight official who was paid to classify the Karate Basin assessment results as inconclusive. Emma set down her coffee cup. The same assessment, Callahan said carefully, whose original reporting was filed by your operative team, which was subsequently buried. And that official is currently employed. His voice was very measured. At a level that requires us to move carefully. How carefully? Carefully enough that I spent 40 minutes on the phone with my director at 5 this morning. He looked at her. This has moved above my authorization level. A special investigator is being assigned. The case is being escalated to a federal task force. Emma absorbed that. The specific shape of it, the way a thing you'd been trying to tell the right people for 9 years could turn out to be bigger than the people you'd tried to tell it to, reaching further, requiring a different architecture of consequence than you'd imagined. The oversight official, she said, has not been arrested, not yet. Callahan's voice was careful and exact. That process is going to take time. It's going to take the right people, the right documentation, the right sequence. He met her eyes. I'm telling you this because you need to understand that this isn't over in a neat 48-hour window. This is going to take months, and your testimony is going to be central to it. I know. You're going to be visible, he said, publicly, in ways you haven't been in 9 years. I know that too. He studied her. Are you prepared for that? Emma thought about the duffel bag under the bed on Caldwell Street, the prepaid phone she replaced every 4 months, the 6 different cities, 6 different names, the particular daily arithmetic of someone who has been invisible by necessity for so long that visibility has started to feel like a theoretical concept. She thought about Marcus Webb's daughter drawing the same house over and over, working something out, about what it might mean to stay in one place long enough that your hands remembered it. "I'll get there," she said. Callahan nodded. He reached into his jacket and slid a card across the table. "My direct line, not the switchboard." He stood. "We'll need your formal statement this afternoon, 2 o'clock if you're able." "I'll be there." He left. The younger agent followed. Emma looked at the card on the table. Then she picked up her coffee cup, cold now, undrinkable, and held it anyway, because her hands needed something to do while her head worked through what she knew. The executives. Reeves. Morrow. The oversight official whose name she still didn't have. The contractor who'd named Morrow and was currently in federal custody and would very shortly be having a different kind of conversation about what he knew and what it was worth to say it. The chain of it, the shape of 9 years of cover-up beginning, slowly, in the gray morning light of an Ashford City Hospital waiting room, to come apart from multiple ends at once. And Hale. Hale, who had sold a room number for $40,000 and a professional favor, who had declared a living man dead in an operating room and then been overruled by the woman he'd been insulting for 11 months. Hale, who was going to lose his license and face federal charges, and who had managed, in the process of trying to protect his position, to contribute to the unraveling of something that went far beyond Riverside Memorial. She thought about the OR, the blood, the silence, the monitor's single tone. The moment she'd walked to that table, she'd had a choice. Not a complicated one, not in the moment, not when she was standing there, but a choice. She could have let it go, let Webb die, stayed quiet, kept her head down, kept being nobody for another stretch of months until she had to move again. She hadn't. She wasn't sure if it was the right choice in the strategic sense, 9 years of careful construction, undone in 30 seconds. But she knew it was the only choice she'd actually been capable of making. There was something clarifying about that. Not comforting, exactly. Clarifying. Her phone buzzed. The prepaid, she'd have to get a new one, she thought automatically, and then thought, maybe not immediately. A number she didn't recognize. Area code she didn't know. She answered. "Is this Emma?" A young voice, very young, 8-year-old young. Emma went still. "Yes," she said. "My dad said I should call you." The voice was careful, reading from some internal script of important things to say correctly. He said, "You're the person who made sure he stayed alive." Emma looked at the waiting room door, the gray morning light through the window beside it. "Your dad is very strong," she said. "He did most of that himself." "He said you'd say something like that." A pause. "He said to say thank you. I don't know your last name, so I can't say it the way you're supposed to when you really mean it." "Emma is fine," she said. "Thank you, Emma." She sat with the smallness of it, the enormous smallness of an 8-year-old's voice saying thank you in the way that meant it, for the reason that meant it. "Take care of your dad," Emma said. "He's going to need a lot of soup." A small laugh. "We only have the kind from a can." "That's the right kind," Emma said. The call ended. She set the phone on the table and sat in the gray morning light and breathed for a while. Outside, she heard vehicles, more than one, pulling up to the main entrance. She could hear the doors, the voices, the organized movement of people arriving with purpose. She stood and went to the window. 3 federal vehicles. Agents she hadn't seen yet, different from Callahan's team. Different vests, different protocols, moving with the specific coordinated efficiency of people who'd been briefed on their way here. A news van at the edge of the parking structure, camera pointed at the entrance, too far to hear anything. The task force, she thought. Faster than Callahan had implied, which meant things had moved overnight, which meant the oversight official and the federal angle had accelerated the authorization, which meant the next several hours were going to require her to be present, visible, and patient. 3 things she was variably good at, in that order. She picked up Callahan's card, put it in her pocket. Then she went to find a bathroom and ran cold water over her face and looked at herself in the mirror for a moment. The scrubs she'd pulled from a linen cart, the lines of a sleepless night, the face of a woman who had made a decision 11 hours ago that had cost her the only version of quiet she'd been able to construct for herself. She looked at that face until she was done looking. Then she dried her hands and walked back out into the corridor. She was halfway to the elevator when she saw him. Victor Hale was at the far end of the corridor, in the custody of two federal agents, being walked toward the main entrance with the specific public visibility of someone whose arrest had been coordinated to happen here, now, in this building, where the people who worked for him and around him and beneath him could see it happening. His jacket was on. His hands were cuffed in front of him, which was standard, and also the thing his eyes kept going to. The cuffs, as if he couldn't fully reconcile their existence with his understanding of himself. He looked up. He saw her. The corridor between them was maybe 40 feet, long enough that the two agents kept moving without noticing the pause, kept walking him forward, and for just the span of those few steps, Victor Hale looked at Emma Carter across the distance of everything that had happened in the last 11 hours and in the last 11 months, and she looked back at him. She didn't say anything. She didn't need to. He looked away first. She watched them walk him through the main doors. The news van outside caught it on camera. The doors opening, the agents, the man between them. And whoever was watching that footage in the editing van or the remote feed would have seen, at the edge of the frame, a woman in surgical scrubs standing in the corridor beyond the glass, watching. She turned away from the doors and pressed the elevator button. What she didn't know, what she had no way to know yet, because Callahan hadn't told her and the morning's arrests were still cascading through the system, warrants being served in 3 different states, phones ringing in offices she'd never been in, was that the oversight official's name had been confirmed an hour ago, and that official had spent 40 minutes this morning, before the agents arrived at his door, on the phone with someone. Not his lawyer, someone else. And that call had been recorded, and what it contained, what it was going to contain when the transcript hit Callahan's desk at 8:47 that morning, was not just evidence of the cover-up Emma already knew about. It was the name of the person who had originally ordered the Karate Basin assessment buried, not the program director, not Reeves. Someone above Reeves. Someone who had been above all of it from the beginning, and who, until 40 minutes ago, had not appeared in any document Webb had collected, in any communication Callahan had intercepted, in any thread of the investigation that anyone had been able to pull. A name that Emma, if she'd heard it 9 years ago, would have recognized immediately. A name she was going to hear in about 40 minutes. The elevator doors opened on the second floor, and Emma stepped out, and the name hit her 43 minutes later. Not 40, because Callahan was thorough, and thorough men didn't deliver information until they were certain of it. She was in the corridor outside the consultation room when he found her. He didn't call her in or ask her to sit down. He just walked up to her with his tablet in one hand and said, "The name on the recording is Aldrich Vance," and watched her face. She didn't move. "You know it," Callahan said. It wasn't a question. "He was the deputy director of the Joint Environmental Assessment Program," she said. Her voice came out steady, which surprised her mildly. "He signed the extraction order for our team in the Karate Basin." She paused. "He was also the one who classified the mission results and listed me as KIA." Callahan let that sit for a moment. "He's been in private consulting for 6 years," he said. "After the program closed, he moved through 2 defense contractors and then into a senior advisory role with a lobbying firm that represents, among other clients, Verano Solutions." He looked at his tablet, then back at her. "He's been on the Verano board in an unofficial advisory capacity for 4 years. The financial connection is in Webb's documentation. We missed it because it runs through a shell company in the Cayman Islands that we hadn't flagged. Until the phone call this morning. Until the phone call this morning." He put the tablet under his arm. He called the oversight official to coordinate their stories. The call was 40 minutes long. He said enough. Emma looked at the wall. At the specific patch of institutional paint that hospitals always had. Off-white, scuffed at shoulder height where carts had passed for years. And she thought about a tent in the Karate Basin, and a dying laptop, and a report she'd written believing it was already too late for the report to matter. "Where is he now?" she asked. "In custody," Callahan said. "As of 40 minutes ago." She turned back to him. "Federal agents picked him up at his home in Colton Ridge at 7:52, Callahan said. He didn't resist. He asked if he could change his shirt first. A pause. "We let him." There was nothing to say to that, so she didn't say anything. 9 years of a life constructed around staying invisible, and the man who'd built the walls around her had asked if he could change his shirt. The charges, she said, obstruction of a federal environmental investigation, conspiracy to commit murder. That covers the hit on Webb and the original extraction order that was meant to eliminate your team. Callahan's voice was precise and thorough. Bribery of a federal official, fraudulent classification of government documents, misrepresentation of operative status, specifically the falsified KYA report. He looked at her. That last one carries personal weight for you, I know. It carries 9 years, she said. I know. She breathed in, out. The corridor smelled like hospitals always smelled. Antiseptic, and something underneath it. The faint human smell of a building that processed suffering and recovery in equal measure. And she'd been in enough hospitals in enough cities that the smell was almost home, which was a thought she didn't finish. What do you need from me today? She said. Your formal statement, this afternoon. Everything from karate to last night. He paused. And eventually, not today, a conversation with the special investigator about the full scope of what you witnessed during the operation, the environmental data, the contamination, what you documented in the report. He held her eyes. What you saw is going to be evidence. The report you filed is going to be evidence. You are going to be evidence, and I want you to understand what that means in terms of process. It means months, she said, probably more. And at the end of it, Callahan was quiet for a moment, not evasive, genuinely considering how to be accurate. At the end of it, you'll have a legal identity again. Your service record will be corrected. The KIA designation will be formally expunged. He paused. What that looks like practically, in terms of your life, I can't give you a precise answer, but I can tell you that the people who buried you are the ones in handcuffs this morning, not you. She nodded once. 2 o'clock, she said. I'll be there. She went to see Webb at 10. He was in a proper room now, one that was in the system, with a working monitor and a nurse who knew his name and federal security outside the door who nodded at Emma when she arrived and let her through without requiring explanation. She registered that small thing without commenting on it. The difference between this morning and last night in terms of how she moved through this building. Webb was sitting up. Not well. He had the look of a man whose body was staging a complaint about the last 24 hours, which was medically reasonable, but upright and present, and reading something on a phone that wasn't his own. He looked up when she came in and put the phone down. Lily called you, he said. She did. I hope that was okay. She's been worried. I thought if she heard that someone was... He stopped. I thought it might help. It helped, Emma said. She sat down in the chair, the same chair from last night, and for a moment they just existed in the same space without filling it up. Callahan briefed me an hour ago, Webb said, about the arrests, Vance. He said the name the way you said something you'd been researching for months and had finally seen with a face on it. I didn't have his name. I was close. I had the shell company, I had the lobbying firm, but I didn't have the direct connection to the program. You had enough, Emma said. Everything else followed from what you had. Everything followed from you not letting me die, he said quietly. Let's be accurate about that. She looked at him. He looked back without flinching, which she appreciated. Your editor, she said. Have you heard? She's fine. Something visibly unclenched in his face. They tried to access her. Someone showed up at her apartment Wednesday night claiming to be from the Tribune's legal team. She didn't let them in. She called the police and then she went to her sister's and turned off her phone. He exhaled. Which is why she was unreachable. She's been in federal protective custody since 6 this morning. She's tough. She's terrifying, he said, with the particular warmth of someone describing a person they'd worked beside for years. She's been in this business for 30 years and she saw what was coming before I did. He paused. She kept the sealed envelope. Didn't open it, didn't move it, just kept it exactly where I asked her to keep it. The story, Emma said. Your documentation. What happens to it now that it's federal evidence? Federal evidence for the trial, he said. But the editorial content, what I wrote, what I found, the story itself, that's still mine. That's still journalism. The Tribune is going to publish. He said it with a flatness that wasn't flat at all, that had under it the particular compressed feeling of someone for whom this moment had been the point of a very long and very difficult road. All of it. The contamination, the deaths in Greenvale County, the cover-up, the people who paid for the silence. He looked at his hands. The people who died because of that silence deserve to have their names in a story that tells the truth about what happened to them. Emma didn't say anything for a moment. "Your daughter draws houses," she said finally. He looked up, surprised by the left turn of it. "She told me." Emma leaned back in the chair. "The same house, over and over, since she was about 5. He shook his head slowly. "I used to think I should get her drawing lessons, teach her to draw other things. Then I thought, maybe she just knows what she wants to practice." A pause. "Maybe it's enough to be very good at one thing." Emma looked at the window, gray day, still undecided, and thought about what it meant to be very good at one thing. About the specific and narrow set of skills that she had spent her adult life developing, that she'd spent 9 years trying to make invisible, that had on a Thursday night in an operating room in Ashford City refused finally to stay invisible. She'd been pretending the skills were the problem. She understood that now, sitting in this chair. The skills weren't the problem. The problem was the people who wanted them buried, and those people were in custody. "Rest," she told Webb. "You've got a long recovery. I've got a story to write." "You've got both," she said. "Do the recovery first." He almost smiled. "You sound like my daughter." "Your daughter is 8 years old and very sensible," Emma said, and stood up. "Pochette." The formal statement took 3 hours. She sat across from Callahan and the special investigator, a woman named Dr. Reyes, federal, compact, and focused with the particular quality of someone who read everything twice and forgot nothing. And she talked. She told it the way she'd trained herself to recount operational experience, chronologically, precisely, without embellishment and without minimizing. She answered every question. When she didn't know something, she said so. When a question required classified information she wasn't certain could be released, she flagged it, and Reyes noted it, and they moved on. It took 3 hours because 9 years of a life laid out in evidence took 3 hours. When it was done, Reyes set her pen down and looked at Emma with the evaluating directness of a person who had just processed a very large amount of information and was organizing her conclusions. "Your report from the Karate Basin," she said. "The original. Do you believe copies survive beyond the photograph Webb had?" "I believe Vance's office held one," Emma said. "It was the original filed copy before the classification. He would have needed it to know what he was suppressing." She paused. "If his office and files are currently under federal search warrant—" "They are," Reyes said. "Then you'll find it." Reyes nodded once. "Your service record will be formally corrected as part of the legal proceedings. The KIA designation, the classified status, all of it. That process will move parallel to the trial preparation." She looked at Emma steadily. "You have done nothing wrong. I want that stated for the record clearly at the conclusion of this interview." Emma sat with that. The way a person sits with something they've been waiting for long enough that the arrival of it doesn't feel the way they expected. "Noted," she said. The news broke at 4 in the afternoon. She was in the hospital cafeteria. Coffee, the real kind this time, from the cart near the south entrance, when it appeared on the television mounted in the corner. She didn't need the sound. She could read enough from the footage, the federal building in downtown Ashford City, the vehicles outside, the movement of people in and out of doors. Then a name on the chyron, then another, then Reeves, then Vance. The cafeteria had a handful of people at this hour. A family at a corner table, exhausted and quiet. 2 nurses on break talking over sandwiches. A maintenance worker eating alone near the window. None of them were looking at the television. Emma looked at it. She thought about Greenvale County and the people who'd been sick for 4 years while executives collected bonuses. She thought about a program director who'd been paid to look at contamination data and write inconclusive in the field marked findings. She thought about the men who'd aimed a car at a journalist at 60 miles an hour because he'd gotten close enough to threaten their comfort. She thought about all the versions of silence that had been required to keep this buried. The silence of the suppressed report, the silence of the KIA designation, the silence of 6 cities and 6 names and a duffel bag always packed under the bed. Her silence. She'd been holding it for 9 years, and she'd thought of it as survival, which it was, but it had also been the thing that let them keep running. She drank her coffee. Let it be complicated. Patricia Sung found her at 5:30. Not in the cafeteria. Emma had moved back to the 3rd floor by then, drawn by a habit she recognized as the habit of a person who doesn't know where else to be, orbiting the place where something happened because the body is slow to accept that it's resolved. Sung came down the corridor with the specific purpose of someone who'd been looking. "The board met this afternoon," she said. "Emergency session." "I heard." "Hale's hospital privileges are formally revoked. His name has been removed from the department." Sung's voice was even, not gloating. Gloating wasn't her register. The board also reviewed the OR footage from Thursday night. The complete footage. She paused. "They've issued a formal statement. It goes out tomorrow morning." Emma waited. "It acknowledges that a nurse at this facility performed an emergency life-saving intervention under circumstances that demonstrated exceptional medical skill and ethical judgment. It acknowledges that the institutional response, specifically the suspension proceedings, was inadequate." Sung looked at her directly. "It's an apology, Emma. A public one." Emma looked at the floor, then back up. "The trauma specialist position," Sung continued. "I've put the formal recommendation through. Given the complications around your identity documentation, there will be a process. But the position will be held." She paused. "If you want it." Emma thought about Callahan saying you'll have a legal identity again, about what it might mean to have a name that was hers, a job she didn't need to hide inside of, a building she could come back to in the morning without calculating the exits on the way in. "I want it," she said. It came out simpler than she'd expected. Just true. Sung nodded. Not warmly, exactly. She wasn't a warm person, which Emma had always found restful about her, but with a firmness that meant it was settled. "Good," Sung said. And then, because she was Sung and not someone else, "Get some sleep tonight. You look terrible." She walked away. Emma almost laughed. Tick. She left the hospital at 6:15, walked back to Caldwell Street through the early evening that had finally decided to be clear. The gray had burned off and left a sky that was doing its best with what remained of the day, orange at the edges, ordinary blue in the middle. The Vietnamese bakery below her apartment was closing up. The owner, a small man named Mr. Tuong, who had never once asked her a personal question and who left extra pastries outside her door when she worked late, was pulling the security gate when she walked past. He looked at her with the usual expression, acknowledgement without expectation. "Late night?" he said. "Long one," she said. "There are rolls left," he said. "Left over. You want?" She almost said no, the automatic refusal of a person accustomed to not being seen and therefore not offered things. She caught it. "Yes," she said. "Thank you." He handed her a paper bag and went back to his gate. She went upstairs, sat on the edge of her bed with the paper bag in her hands and the duffel bag visible underneath the bed frame, still packed, exactly where it had been for 11 months. She looked at it for a while. Then she reached under the bed and pulled it out and opened it and began to unpack it. Not dramatically. It wasn't a dramatic action. Just clothes and a phone charger and a water bottle and a flashlight and the small collection of practical things that a person carries when they're always ready to leave. She put the clothes in the dresser. She put the charger on the nightstand. She put the flashlight in the kitchen drawer where flashlights belonged. The duffel bag she folded and put on the shelf in the closet. She sat back down on the bed and ate one of Mr. Tuong's rolls in the quiet of her apartment. And the quiet was different from what it had been the night before, in the way that the same room can be different depending on what you bring into it. 3 months later, Marcus Webb's story ran in the Callaway Tribune, 12 pages. Front to back. The contamination in Greenvale County, named and documented. The executives, named. Reeves and Vance named with the full chain of evidence laid out in the methodical and precise prose of a journalist who'd spent 8 months making sure every sentence could survive scrutiny. The deaths in Greenvale County, 11 people, over 4 years from illnesses connected to the groundwater, named individually, with photographs, with the details of their lives. Not just statistics, people. The story was picked up within 6 hours by every major outlet in the country. The Verano executives were convicted 4 months after that. Reeves received 22 years. Vance, whose charges carried the additional weight of the operative cover-up, received 31. The oversight official received 17. Morrow received 14. The contractors entered plea agreements and received reduced sentences in exchange for testimony that helped close every remaining gap in the case. Dr. Victor Hale lost his medical license on a Wednesday morning in a proceedings room with no audience beyond the licensing board and his lawyer. His federal charges, obstruction, accessory, resulted in 18 months and a fine large enough that the professional favor he'd been angling for in Carver City became, in that context, almost absurd. He did not issue a public statement. There was nothing, finally, that the statement could have been for. Webb published his account of the hospital, his 48 hours in Riverside Memorial, the man in the street clothes, the compromised IV line, the woman who moved him to an undocumented room and fought 2 trained contractors in a red-lit corridor, in a follow-up piece that ran 6 weeks after the first. He wrote it the way he wrote everything, without embellishment, with precision, letting the facts do the weightlifting. He did not name her without her permission. He asked. She said yes. She read it in the break room on a Tuesday, on her lunch, in the surgical department of Riverside Memorial, where she now held the position of lead trauma specialist. She read it once. Then she folded the newspaper and put it in her locker and went back to work. The reporters found her on a Thursday afternoon in late fall. She'd known they would. Callahan had warned her, and Sung had warned her. And Webb, who understood journalists the way mechanics understand engines, had warned her most specifically of all. She'd prepared for it the way she prepared for most things, practically without excessive rehearsal, accepting that it was going to be imperfect. There were 4 of them outside the main entrance when she came off her shift. She recognized the Tribune's photographer from Webb's description. The others she didn't know. They had the organized alertness of people who've been waiting a variable amount of time and are now engaged. She stopped at the top of the steps. Let them come up. The questions came in the usual overlapping way that questions came when multiple people asked them at once. Her name, her background, the OR, the conspiracy, how she felt about the sentences, what she would say to the families in Greenvale County, what she would say to the people who'd listed her as dead, what she would say to the hospital that had tried to suspend her. She waited until the initial wave settled. Then she said, "I did my job. That's the whole story." A reporter from a city paper pushed through. "You spent 9 years in hiding. Does it feel like justice?" She thought about that word, the shape of it, the weight, what people meant when they used it, and whether what she felt matched the definition. "I think justice is slower and messier than it looks from the outside," she said. "It took 9 years and a journalist who wouldn't stop and a patient who survived long enough to be found." She paused. "That's not a clean story. But it's the true one. Are you glad you came forward?" She looked at the question, at the reporter asking it, young, earnest, the kind of person who still believed that the people they were interviewing would give them the answer they were looking for if they phrased the question exactly right. "I didn't come forward," Emma said. "I did my job. Someone was dying. I did what I could. The rest of it..." She looked at the building behind her, at the entrance she walked through every morning now without calculating exits. The rest of it happened because other people did their jobs too. Webb, his editor, Callahan, the agents. She paused. "You can't separate mine from theirs and call it one person's story. It was never one person's story." They wrote that down. Most of them wrote it down. She walked back inside. Again. She thought about it that night, the way she thought about most things. Not immediately, but later, when the day had settled and she was in her apartment above the bakery. The duffel bag on the closet shelf and the flashlight in the kitchen drawer and the scrubs on the chair and a cup of tea going cold on the nightstand. The reporters had wanted a clean arc. Suffering, perseverance, triumph. The underestimated woman who proved them all wrong. She understood the appeal of it. It was a satisfying shape. But the truth was that she hadn't spent 9 years building toward a moment of vindication. She'd spent 9 years trying to stay safe in a world where the people with institutional power had used it to make her disappear, and she'd been doing it alone because being alone was what the situation required, and she'd gotten very good at it in the way you got very good at things you had to do, whether you wanted to or not. The moment in the OR wasn't a turning point she'd chosen. She hadn't decided to be brave. She'd seen a man dying who didn't have to die, and she'd had the skills to do something about it, and she'd done it. That was it. That was the whole of it. What she'd learned, what 9 years and 3 months in Ashford City and one very long Thursday night had taught her, was that the system built to erase people did not always work. Not because courage prevailed, not because light overcame darkness, not because any of the things people said in moments like this were reliable or guaranteed. The system didn't always work because systems depended on everyone in them doing what they were supposed to do. And sometimes someone didn't. Sometimes a journalist looked at a document and thought, someone needs to know this. Sometimes an agent spent 4 years building a file on a name they couldn't place. Sometimes a woman who'd been invisible for 9 years looked at a dying man and did the one thing she was best at. Sometimes the smallest refusal, the refusal to let go, to stay quiet, to keep the duffel bag packed, and the head down, and the distance maintained, was the thing that mattered. She had spent a long time believing that her skills were a liability, that what she knew and what she could do were things to be hidden, managed, reduced to the smallest possible footprint. She'd been wrong about that. Not dangerously wrong, not fatally wrong, survivably wrong, which was the only kind of wrong worth being when you were operating alone and trying to stay alive. But wrong. What she was had never been the problem. What she was had, eventually, been the answer. She drank her tea, cold now, which she'd expected, and looked at the window and the dark outside it and the ordinary lights of Caldwell Street reflected against the glass. Tomorrow she had a 7 o'clock shift, 2 post-op patients to check, a trauma assessment scheduled for 9, a training session with 2 new surgical nurses in the afternoon that she'd been asked to lead and had agreed to lead, because if there was one thing she knew how to do, it was show someone how to stay useful in a room that was falling apart. She turned off the light. She slept. Not the sleep of someone waiting to leave, the sleep of someone who was, for the first time in 9 years, exactly where they were supposed to be. In the morning, she would go back to work. That was enough. That was, she thought, more than enough. It was everything.